friends, how are you? I hope everyone is good today. So we will be discussing today topics is Wilson disease. What is Wilson disease? Wilson disease is an autosomal recessive metabolic disorder in which it will impair our copper excretion, causes copper to accumulate in our body, basically in our liver. So it is the mutation in ATP7B genes which will impair our copper excretion in bile due to chiroplasmin. Okay, what is chiroplasmin? Chiroplasmin is a copper containing enzyme that play a role in a body iron metabolism. So when we have a decrease or less of chiroplasmin in our liver, it's hard for the liver to excrete copper from the liver. So, okay, Wilson disease most commonly occur in age between 5 and 35, and more than 35 years also it will be occur, but it's less chances. So next we will be going for the clinical feature. First will be liver disease. So Wilson disease most occur in patient with liver disease. It means the patient previously have a liver disease such as acute hepatitis, cirrhosis, fulminant hepatic failure. So next clinical feature will be Kaiser-Fisher. So before we go to the explanation of Kaiser-Fisher, we will go to the why it's occur in our body. So when copper accumulate in liver, so our hepatocyte will be degenerated. So there will be leak of copper in our plasma, and when it leak, it will go, not only it will be accumulate in liver, it will be accumulate in kidney and brain and also our cornea. So when we come to the cornea, Kaiser-Fisher which is occur in our cornea, which means it yellowish ring in our cornea. So this is a very most common clinical feature we can see in Wilson disease patient. Okay, next will be CNS. CNS is only occur in advanced stage. So it's in the beginning we can't see the changes in CNS or the diseases of CNS. So advanced stage such as Parkinson syndrome and psychiatric problem. Most psychiatric problem will be like anxiety, depression and etc. So next will be diagnostic. So or test that we will taken to confirm that patient have Wilson disease or no. So as I told you before, the clinical feature. So under clinical feature we got see liver disease. So for test also we have to see hepatic disease. So before I have told that acute hepatitis, cirrhosis and fulminant hepatic failure. So for this liver problem we have increase of aminotransferase. So when we have in a lab test increase of aminotransferase, we can confirm that the patient might have Wilson disease. So the next will be for a more confirmation, we have to see the serum ceruloplasmin level, as I told before also. But in this thing, serum ceruloplasmin level will be decreased in that patient, because that's why copper is not excreted and also it is deposited in our liver. So the last test will be liver biopsy. This is for the advanced. We can see for the patients already the liver will be much bulger. You can see in your emergency room. So for this Wilson disease, there is treatment. Okay, so we can treat it by two ways. First is by giving them chelating agent, which means it's a medication for them to give penicillamine. Penicillamine is a detoxify excess copper, so it will digest the excess copper from our body. So this is for the early stage of Wilson disease. And the next one is liver transplant. This is the for more advanced stage of Wilson disease. When the patient have liver transplant, it seems the patient might have acute hepatitis, and also next they will have Wilson disease, then it will be more complicated disorders or diseases occur. So guys, here are the tips and also the discussion of Wilson disease. So I'll be posting the management of Wilson disease in my page, Easy Medicine Facebook page. You can go and just download that notes there and read more about that. And see you guys for next video. Take care. Bye.